Deb and I are here at Meadowbrook Equestrian Center with Melissa Davis and Holly to demonstrate a couple of Dr. Sue's stretching exercises that she recommends after their chiropractic treatment. The first one I'm going to show you is the 45-degree side stretch. The idea of the 45-degree side stretch is to get a complete rounded bend that stretches from the hip all the way through the neck. And how you do that is by standing just in front of the horse's girth line. I have a cookie in hand. I am going to ask Holly to reach down and around. So, Holly, I got Cookie here. And I'm going to ask her to come down. And I want her face and pole in alignment with no nose tipping. I'm going to ask her out. She's tipping her nose. Right about there. Any further than that, she had to tip her nose up to get. But as more supple your horse gets, she should be able to reach all the way in between my legs without flipping up her nose, keeping her face and pole in alignment in a vertical reach. So I'm going to try one more time. Always, of course, what you do on one side, do on the other. So I'm going to ask her to come down and reach around, right about there. Nope, she tipped. I'm not going to give her the cookie. Yeah. Come on, Holly. Right. She's cheating. There. That's what you're looking for. And be patient with them, just like us stretching. Could be a little bit sore and stiff at first, but just keep building that. Use whatever Dr. Sue's recommendations are for how many times on each side per day.
All right, now we're going to demonstrate the wither lift, and this helps the horse engage the muscles that will help them when you're riding under saddle, so that they know how to lift themselves up and actually move in a more balanced manner. What you're going to want to do is make sure that their foot is far enough forward that you can get between their legs. There's a midline that you're going to feel for. It runs from the chest down the middle of their belly, and you're going to come just your side of that midline right behind the elbow here, and you're going to put a pressure point there. Then you're going to change your focus to up here at the withers. This is a very subtle move, and you're going to irritate down in between the front legs, just your side of midline, and ask them to lift that wither. I don't know if she did it.
I saw it.
She did that, and I hope it shows up on camera. It's a very subtle move, as I said, but it just engages those core muscles so that she will know how to engage them when you do get under saddle. And again, you'll want to do this on both sides, and you'll have to refer to your treatment sheet, because every horse is different, and see how many times the doctor has recommended that your horse have that done. The third exercise that we're going to demonstrate for you today is the butt tuck. And its purpose is to help the horse learn how to engage its pelvis and raise its lumbar spine and its mid-back in this area, so that when you are riding under saddle, they know how to raise themselves up and engage their back end, and they can move in better posture. So if you come around behind the horse, I'll show you how to do this. With the horse standing fairly square, what you want to do is find the groove that the tail sets in and be within about a ½ an inch of where the tail is. Set your thumbs just above the point of the butt right here, and then put some pressure on and run your fingernails up, and you can see her tuck her butt in underneath of herself. And that is engaging her pelvis and raising her lumbar spine and her mid-back. This again will help the horse to move in better posture when you're under saddle. I'll show that one more time so you can see it from the side. And there you have it. That's the butt tuck.
These exercises are always on your treatment sheets that you receive after every treatment from Dr. Sue. But I always get asked, how do I know if my horse needs a chiropractic adjustment? Well, my answer is almost every single one I've ever seen up and down the state needs one. But things that you can do for yourself is walk your horse on a flat, hard surface, gravel, asphalt, and listen to their footfall. Does it sound even? Can I tell the difference between the right front and the left front, or the left hind and the right hind? The second thing I'd ask myself is, when I'm watching my horse stand, is he naturally standing square, both feet in alignment with one another underneath himself, or is he always putting one foot forward or one foot back? These are just signs to tell you that maybe something's not quite right, and you may want to consider calling Dr. Sue.